programs that can be used. Unfortunately, I don't have too much familiarity with those, but I think some of the private practices may be using those tools. But we do need to consider how we use these tools to assess for any issues or adherence. In what ways can those apps be improved? It's really important to provide feedback to the companies that have those apps or web-based programs, so that they know what changes would make it more user-friendly or more would give them more information, all of us, in terms of taking care of our patients. And lastly, I think it's really important for us to think about our practice settings and what we do daily. Think about evaluating what we're doing and where there might be some room for improvement. So what does the model that your clinic use, what does that look like today? How is oral chemotherapy managed? What role do you or other nurses play today in that oral chemotherapy process? Are there opportunities to expand your role? Definitely something to think about, because the resources piece is such an important thing to think about, and how we leverage the people, the staff that we have to do this work. Is there a structured process for following these patients? How are they monitored? How is that documented? Who verifies that patients are taking their medications correctly? How do you do that? How often are you following up with patients, either via phone, electronic communication, or in an office visit? We need to identify these opportunities for improvement and work towards closing those gaps in our current models. Are there dedicated individuals who are responsible for monitoring patients? Providers are busy. There's no doubt about that, and I feel confident saying that that's probably not going to change anytime soon. So how can we mobilize those qualified individuals, so you nurses, who are around them, to help with all of this work? When we provide education, is there a dedicated space for this? I think sometimes education can feel rushed when there isn't a dedicated space or a dedicated time to providing that education. And then when you think about following up, does the approach that you're using today, does that work for most of your patients? Or, I would say that what might work for some patients may not work for all patients. So do we have that room to be flexible and creative and tailor to our patients if we find that that's what's needed? Attempting other approaches that might be more effective, or at least entertaining them. So I think you can clearly see the support our patients need when they're